All right, Department of Health and Human Services of America, Make America Healthy Again, or MAHA, plus 500 million. Building the Working President, Make America Healthy Again, with a commission with Executive Order 1421-2 with itself with the Make America Healthy Again Commission. Budget provides 500 million dollars to Make America Health Again, an initiative that would allow the Secretary to tackle nutrition, physical activity, healthy lifestyles, over resilience of the medication treatments, for the effect of the technology, habits of the environmental impact, food, drug quality, and safety of the HHS. Cuts and reduction consolidation of the LIHEAP, the Administrative of the Comparative lowering energy costs for the American families, unleashing the energy production low-income home energy assistance program is not necessary for the becoming the state of the policy for the prevent utility disconnection from low-income households with the effect of the making the LIHEAP that pass through the benefiting utility of the Northeast with the LIHEAP, the reward state with like New York and California, two top recipients of LIHEAP funding, which would have implemented the anti-consumer policy with the drive up home energy policy with the government accounting office has raised significant program integrity concern with the related with the fraud, with the abuse of the lie heap of the 2010 when the government accounting office investigators audited with the 7 states of the funded names of 11,000 dead people, hundreds of the prisoners, the applicants for the fund, more than 1,000 federal employees whose federal salaries exceeded the maximum income threshold received benefits. Several cases, people living in $1 million homes receive benefits. The budget proposed at the end of this program instead of the support low-income individual for the energy dominance of the lower price and American First Economic Plan. That's it. Negative $4.025 billion. All right, refugee unaccompanied by the alien children programs, negative $1.97 million. Refugees arrival adopt significantly executive order 1463 realigning the United States refugee mission programs, and those who would advise arrive do not have it except for the American taxpayer to support them. Further, these funds were weaponized by the Biden-Harris administration, given the cash handout with medical service and job training illegal immigrants. The budget proposed eliminating these programs, which just also refocuses the unaccompanied alien children programs on the core mission of the sheltering unaccompanied alien children while protecting the children trafficking and labor exploitation. New York Times exposed the Biden-Harris administration operated with the program like an assembly line, prioritizing quick release of the children, insufficiently vetted with the responsibility over to the children's safety employee with the HHS, Human Health Services Office of the test of the 2024 with the human trafficking southern border. So she horrified to discover the children were being trafficked in the billion of taxpayer dollars, by contrary failing to the vet-sponsored process for children safely. Government office complicit in it. Community Service Block Grant, or CSBG, negative 770 million. Budget proposed to eliminate the of the community action agency that will carry out the own agenda with the grants related with the equity building, green energy initiative of the California Community Action Partnership with the focus of the effects of the effort into bringing the DEI to the forefront with the office of the focus of the group, extensive training opportunity with engaging fruitful partnership with the how that could be transforming the system and the structure that have economically placed low looking practice with the resource loads over the power dynamics of the really mentally models that we need to shift in order to change the system. According to Health and Human Services, the Community Action Agency, with the Wisconsin of the Community Service Block Grant funds of the combined with the clean energy with affordable housing to pursue with both economic and environmental justice. Americans in need of job training help hand would be better to serve with the programs funded by the Department of Labor and Agriculture, according to the Government Accounting 2019 study. And the Health and Human Services cannot assure that Congress and the American people that the funding is meeting is intended for the purpose of reduce the cause of poverty. Preschool development grants, a negative $315 million. Consider the administrative priority of the returning education state, which is most equipped with the funding of the tailor of the education program with the need of the resident. Budget eliminates preschool development program. Preschool development literally does not fund any of the preschool for children and their families, and the funds capacity for the building strategic initiatives. These unproductive funds have weaponized the Biden health administration and the extent of the federal reach of the DEI policy for the toddlers. As an example, the Minnesota Department of Education guiding principle of the implementation of the preschool development grants include the intersectionality and racial equity. Health and Services Administration, the HRSA, negative $1.732 billion. The budget consolidated various programs there were formerly Health Resource Services Administrative Consolidation, included with the Ryan White with the HIV and AIDS program, active with the do not focus with the healthcare support services that directly patients, such as education and training, negative 740 million, multiple mature children health program, negative 274 million, with where duplicated order of federal programs could be addressed with the roof of the block and blank grant funding, multiple health work programs, negative $1 billion worth of provide scholarship with support of the individuals entering high-paying medical careers, family planning programs, negative 286 million, which are the taxpayers fund with a nonprofit not aligned with several administrative policy of the budget maintains $6 billion for prior activity or formerly with a health and resources service administration consolidation. Center of the Disease Control Prevention Programs, negative 3.588 billion budget budget refocus for the Centers of the Disease Control Mission with core activities emerging infectious disease surveillance outbreak investigation maintained with the national public health and infrastructure with a streamlined program eliminating waste. The budget proposal with emerging multiple programs, one grant program giving state with the flexibility to address local needs. Specifically, the budget program proposes consolidation funding with the infectious disease with the opiates, viral hepatitis with the schedule of transmitted infection, tuberculosis programs, and one grant program funded by $300 million. Budget eliminated the directive of the DEA. Simply unnecessary programs included with the National Center for the Chronic Disease Prevention Health Program, Promotion, National Center for the Environmental Health, the National Center for Injury Prevention, Control of the Global Health Center for the Public Health and Preparedness Response, which can be conducted more effectively by a state with the preventive health and human supplies, the purpose of which can be bus funded by the states for the budget resource for the Center for the Disease Control of Emerging Infectious Disease, Surveillance Outbreak Investigation, Prepared Response with maintaining national public health infrastructure. The budget maintains more than $4 billion in essential disease control. National Institution of Health, $17.965 billion of administration committed for the restore and accountability, public trust, for the transparency for the National Institute of Health. The National Institute has broken the trust of the American people, wasteful spending, misleading information, risky research for the promoting dangerous ideology, undermining public health, while evidence of origins of the COVID-19 pandemic, leaking from the laboratory, confirmed with the shovel of intelligence of the agency with the National Institute of Health, inability to prove with the grants of the Wuhan Institute of the Virology, with were not complicit with such possible leak with get data for the holding and receipt of the federal funding accountable to evidence the National Institute of Health has grown with the big with the unfocused further with the National Institute of Health that is involved with the dangerous game of the gain of function research and failed with the adequate address it will further undermine the public confidence with the National Institute of Health. The National Institute also promoted racial gender with the ideology detriment of the American youth. For example, the National Institute of the Health funded with a study told the psychosocial function of the transgender youth after 2 years of hormones, on which 2 participants tragically committed suicide. With the budget purpose of the reform of the National Institute of Health, focus on the National Institute of Health research activity. The President commitment of the Make America Healthy Again, including consolidation, multiple overlapping ill-focused programs with 5 new focus areas that ICE associate is spending reform of the National Institute of the Body System Research, the National Institute of Neuroscience Brain Research, the National Institute of General Medical Science, the National Institute of Disability-Related Research, the National Institute of the Behavioral Health. The budget eliminates the funding of the National Institute of the Minority Health Disparities of negative $534 million. Repeat with the DEI expenditure for the Fort Garrity International Center with negative $95 million. The National Center Complementary Integrative Grant with negative $170 million. The National Institute of Nursing Research negative $198 million. The National Institute of the Research aligned with the present priorities of address chronic disease with the other epidemics, implementing executive orders eliminating research for the climate change with the racial gender ideology, diverse racialism, new structures retained with advanced research projects agency for the health. The budget maintains $27 billion with the National Institution higher. Health and Research, Substance Abuse and Mental Health Service Administration, negative $1.065 billion. Administration committed with the combating source score of the deadly drug with the ravage of the American communities. Unfortunately, with the previous administration, with the Substance Abuse with the Mental Health Service Administration eliminates grants used to fund dangerous activities billed as harm reduction, with included funding safe smoking kits, supply syringes for drug users. The budget for purpose of the refocus activity where formerly the Substance Abuse with the Mental Health Service Administration reduces waste, eliminating the inefficiency of mental health programs regional with a national significant substance with the prevention program of regional national significance substance of the U.S. treatment program of the regional national significance. These programs are duplicate other than federal spending, are too small to have a national impact, eliminates proposed federalism as they are services. Also supported mental health and substance abuse of the disorder block grant fund. The budget maintains a $5.7 billion activity formerly as the Substance Abuse Mental Health Service Administration. Agency of Health Care and Research Quality, or AHRQ, negative $129 million, is supposed to reach over the examine the qualify and safety of the affordability of health care delivered with the perspective of the patient, of the caregiver, the clinical preference, of the how much of the research, of the wasteful, the duplicate of the research conducted elsewhere with the department, such as the National Institute of Higher Health, which eliminates from the defective of the duplicate of the waste grant for the contract with include with the line with the administrative of the priority of the previous administration of the HRQ, Agency for the Healthcare Research and Quality, to the published information related to Making America Health Again, included a document titled Reducing Healthcare Carbon Emission with the primary measure of the action of the mitigate climate change with the Agency of Healthcare Research and Quality has published radical gender ideology of one to children funding project with the Seattle Children's Hospital titled the U.S. Telehealth Improve the Access to Gender Affirming Care of the BIPOC rural gender diverse youth. Budget increase with accountability with the prioritizing Agency of Health Research and Quantity with the statistically work eliminates digital health portfolio. Each new grants and offload contracts interagency agreements associated with the statistical activity budget consistent with a recent announcement of the Health and Human Services Organization. The Agency of the Health Research and Quality functions are now part of the new Health and Human Services Office of the Strategy. Center of Medicaid and Services and Program Management, CMS, negative $674 million. Cuts will have no impact on providing benefits of Medicare and Medicaid beneficiaries. The budget eliminates funding that has been carried out with a non-statutory waste of the woke activities while maintaining funding with the core medical and Medicaid operations such as any of the necessary with the DEI supports contracts, eliminates healthy equity-focused activities with Inflation Reduction Act, related outreach and education activities. Administrative strategic prepare for the response of the hospital preparedness program, negative $240 million. Budget eliminates the administrative strategic preparedness for the response hospital preparedness program, which has been wasteful, unfocused with the proposal remedies of the flaws along with state and territories to prepare properly scope and fund hospital preparedness. Alright, Administrative of Healthy and American Sexual Risk Avoidance Program, the Teen Pregnancy Prevention Program, Health and Human Services Office of Women's Health, the Health and Human Services Office of Minority Health. Negative $180 million. The budget eliminates sexual risk of the avoidance for the program, serve the less of the one youth nationwide, the duplicate of the mandatory sexual risk association avoidance education program, and administrative children of families. The budget eliminated for the teen pregnancy prevention program, which is some of the mandatory personal responsibility education program, and administrative of the ACF, the administrative of the children and families. Budget also reduced fundings of the Health and Human Services, the Office of the Minority Health, the Office of the Women's Health, to promote efficiency and invest in areas that align with administrative priorities. These programs were previously under the Office of the Assistant Secretary of Health, consistent with the recent announcement of the Health and Human Services Organization. Budget relocates the program to the newly funded Administrative of Healthy America. Environmental Protection Agency